All right, let's go ahead and get started. So my name is Mike. I work at PEPID Medical Software, and so I'm going to be presenting this in this virtual booth by PEPID. And the first topic that we've chosen for today is content is king. This is a phrase that you hear a lot in the marketing world, but we're gearing this towards obviously our medical expertise, and specifically focusing on what does it mean to be truly point of care ready. This is obviously a term that we hear a lot, being focused on point of care, helping practitioners at point of care. So I wanted to take a closer look at what that means and how PEPID is specialized to help with that as well. So obviously we live in the information age. There's more information available to all of us in every area of life, and of course this includes the medical world as well. So any physician, practitioner of any level that's out there knows that there's a lot of different resources that are available to us when we're looking for medical information to help us make medical decisions. I listed on this first slide just some common examples. Obviously, everybody is familiar with UpToDate, Lexicomp. PEPID is a provider of medical information as well. And Hippocrates, 5-Minute Clinical Consult are other examples. All of these first several examples are all marketed as point-of-care tools. There's other examples out there. Of course, PubMed is used for research information. A lot of clinicians like to go to podcasts to keep themselves informed and updated about the information out there. And so, again, to the point of our presentation today, I wanted to focus in on what makes one source of information truly point of care ready versus alternatives. What does that mean, and how can we optimize the information that we're delivering so that it is helping clinicians at the point of care? So speaking from the standpoint of PEPID as a company, we wanted to focus on being a point of care resource. And what does that really mean to us? You know, what's our focus and our goal when we're creating content or when we're trying to deliver tools, resources that clinicians are going to use? And in essence, that comes down from our perspective to this question of what makes a difference in helping facilitate medical decisions. Put in other words, it's what's going to help me as the clinician, as the provider, make a choice about patient care that's going to help me progress through my workflow. That's what being point of care ready means to us. And the key points or the key factors that we always want to consider whenever we're creating content or whenever we're trying to focus on point of care is being, number one, evidence-based. Obviously, this is critical. Obviously, we want to make sure that the information that we're presenting is sourced, cited from evidence-based resources, that there's evidence, the weight of the evidence is behind the recommendations that we're giving. Another key factor is fast navigation. The way that I'm moving between different pieces of information or different tools is obviously important for the point of care. Again, to the point about progressing through my workflow, helping me make a choice about patient care. I don't want to have to wrestle with the resource that I'm using. I don't want my navigation to be clunky or confusing in any way. It needs to be intuitive. It needs to be something that I can move through quickly when I'm looking at different pieces of information or just wanting to find the thing that I want to find. The next piece is high yield content. So what we mean by that is we want to deliver information that is distilled down to what you need to know, what's going to be helpful to you, what's going to help you, again, progress through that workflow. We don't want, at the point of care, to be weighed down by extraneous information or things that I don't need to be looking at in that moment. Not to say that that other information might not be interesting or informative in any kind of way, but again, when we're speaking about point of care, what's going to help me progress? That feeds into the next point, of course, relevant information, things that are specific to my decision tree, things that are specific to my goals when treating the patient, relevant to my specialty and so on. So really focusing on what is going to give me the information that is helping me progress, the information that I need to see in that moment at the point of care, and stripping away anything that, even if it's useful in other contexts, isn't useful in the context that I'm in when I'm treating patients, when I'm at the bedside. So I wanted to illustrate just a couple of these points, again, using the perspective of PEPID. We're creating content, what this means to us, and how we try to focus. So I wanted to have a little visual aid here asking, which is easier to read? On the left-hand side, I've got my short, concise bullet points, or on the right-hand side, a lengthy, detailed paragraph that gives lots of good information, but stretches on for a significant amount of space on the screen, et cetera, et cetera, et cetera. I think that on an intuitive level, a lot of us just know that bullet points are easier to read than long paragraphs are. Again, nothing against long paragraphs. We all love to get, extensive information. But when I'm trying to assess a situation and make a decision quickly, bullet points are just easier to absorb. This is a really simple point, but it makes a huge difference. It's something that my professors in university would have referred to as cognitive task load. How do I make sure that I'm able to absorb information or absorb details that I need more rapidly? And a simple formatting decision like organizing your information into bullet points can make a lot of difference when I'm trying to, progress through my workflow, as I'll keep saying repeatedly. What's easier to process? Again, on the left-hand side, I've got the idea of content that's specific to your specialty. On the right-hand side, rather, content that's combining all different specialties into one space. Again, we like the idea of being comprehensive, and that's important. We want to make sure that the information that any given specialty wants is, of course, available to them. But for an individual who's trying to process that information, what we normally find is that they prefer to have content that's specific to their specialty, specific to their care process and what their goals are as a provider, and not having a content that's not specific to their situation. A nurse has different concerns when they're treating a patient than a pharmacist does. And so we want to be able to present the information that's relevant to you and strip away the content that's not. What's more convenient? What's a more convenient way to progress through that workflow? On the left-hand side, I've got the notion of one interface that covers all of your related content in CDS in one tab, or would you rather have one tab that's open for your treatment guidelines, another tab for your drug information, another tab to do your dosing calculations, another tab to check for drug interactions, and a final tab that's where you're going to be placing your orders? Returning to the idea of cognitive task load, we know that switching between different tabs is an interruption in thought process. And so when we're organizing our information, we try to streamline things to keep you within one tab, within one flow, as much as possible, so that you don't have to do those switching motions and change your train of thought in the middle of what you're doing, reorient yourself to what you're seeing on a different tab, instead of saying, here's a piece of information I want to find. I want to look for drug interactions. I was looking at a drug. I'll navigate directly there. And then that's what's on my screen instead of needing to open another tab or start a new thought process. So in summary, I wanted to make the point that the organization and the presentation of medical content is as important as the information itself. The premise of this presentation was, what does it mean to be point of care ready? And I will often use the example of a resource like PubMed, which is a wonderful resource, has lots of information, lots of interesting, informative, and useful information in it. But you're not going to be looking at PubMed when you're at the bedside. Why is that? It's not because PubMed doesn't have the information that you would need within it, but it's because that information isn't being organized and presented in a way that's geared towards point of care. So I'm going to transition now from my slides to showing, again, from PEPID's perspective, what PEPID has done to try and orient our tools and our resources around the point of care, around making sure that clinicians who are at the bedside, who are in the act of treating patients, can find the information that they want to find, and again, have their medical decisions supported. So what I'm looking at here is I'm at PEPIDconnect.com. This is just in the web browser. PEPID has a mobile app as well, but it's a little easier for these online presentations to use the online portal. And the first thing that I'll point out is on the left-hand side, I'm logged in as using our generic login for our editorial team, so I have access to all of the different suites that PEPID provides. And you can see that we've got a selection here that's organized by specialty: emergency medicine, primary care, clinical rotations for medical students, professional nursing, oncology nursing, EMS, etc. This is speaking to the point that I made earlier about finding information that's relevant to your specialty, trying to use tools that are focused on what your care process is, and not weighing you down with extraneous information or detail that is not going to be something that you need to follow. So PEPID organizes all of our content in our knowledge base by specialty, and that's one of the ways that we're trying to support clinicians at the point of care. You can see that my list goes on for quite a while here. We have quite a selection available. For the purposes of this demonstration, I'm going to click on our emergency medicine suite and navigate to there. In the world of emergency medicine, obviously, time is at a premium. This is a space where you really do need to be point of care focused because time is of the essence. Seconds matter in the emergency room. So you really want to be able to find the thing you want to find quickly without a lot of interference. To briefly orient with the layout of this online portal, I've got a search bar here at the top. This is where I can search for clinical topics, drug information, disease information, conditions, guidelines, etc. We have some tabs underneath that show all of PEPID's CDS tools. This includes drug interactions. I have a drug allergy checker, a library of medical calculators, a differential diagnosis tool, a lab manual with reference ranges. We have a pill identifier tool, news and alerts to highlight topics that are either recently updated or in the news lately, things that our editorial staff wants to highlight. And then under the More tab, it continues to go on from there. We have an ICD lookup tool for looking up billing codes, an indications tool allowing you to look for drugs by their indication or vice versa. We have an IV compatibility tool checking for compatibility between IV drugs or with IV solutions. And then a dictionary here. This is just an alphabetized list of medical terms that we have in the suite. We also, again, speaking to the point of organization and presentation being important, what you'll see as I continue to navigate is a two-panel layout. We have a panel on the right-hand side here. This is where most of your content is going to show. Right now, this is showing kind of a main table of contents page, showing all the different subject areas that I can drill down to if I want. And then on the left-hand side is a left-hand panel that we use for our navigation and tools. So I'll go ahead and show you how this works. So I'm going to search for a condition, let's say VTAC, ventricular tachycardia. I've got my search results here, and I'm going to click on VTAC. That's the topic that I want to view. You can see, just to show the yellow highlights here on the right, we've got an option for notes for people who want to add personal notes, or for an institution that wants to use PEPID. We have the option to add notes on any topic if you have specific guidelines or things that you want to remember, things relevant to your organization. We have a notes feature, as well as the ability to add a topic as a favorite. If I want to click on that star, then I can add this topic as a favorite. And so let's focus on the content. Again, the title of this presentation is Content is King. So let's look at our content, our monograph for ventricular tachycardia. And the thing you'll notice, just like the first example that I gave, is everything in PEPID is written in bullet points. We want to be comprehensive, of course, that is important, but we also want to be concise. That is crucial, especially, again, in the emergency room. It's easier for a clinician, especially if you're under pressure or in a time-sensitive situation, to absorb information that's organized into short sentences or short single-word reminders like this, instead of scrolling through a long paragraph. You'll also notice that we link in other tools or other pieces of content directly into the monograph, such as images. So I've got an example here of torsade de pointe. I apologize for my poor pronunciation. I can click to view an image and I can get a rhythm strip. It's right here. It opens in the same screen as I was viewing before. We don't open other tabs. We try and keep you within that one flow for navigation. To that point, on the left-hand side, in my left-hand panel, this is what we call our quick links. Each of these subheaders here correspond to the subheaders that are in the monograph on the right-hand side. So if I want to jump to a particular section, let's say that I want to look at disposition for this condition for the patient, then I click on disposition and now I'm at that section within the monograph. Again, focusing on the idea of supporting medical decision-making, I want to know straightforward information about, what's the admission criteria for this condition? What are my discharge and follow-up instructions? What do I need to know for further management for this condition for that patient? We try to organize our content as deliberately as possible, focused around what does a clinician need to do now to progress through their workflow, to make that next decision, and to get the patient ultimately where they need to go, getting the best treatment possible. So this content we hear all the time from our subscribers is really helpful for them in drilling down to the essential needs that they have, and they don't need to scroll or scan through lengthy paragraphs when they're trying to find something that's straightforward. So that will help them out. Again, let's say that I want to find a treatment option. Let's say my patient is in stable condition. I have a stable patient here in my acute treatment section. I can click on that quick link, and it will lead me right to that section for a patient that is hemodynamically stable. Another thing about our organization, and I made a point about this in the PowerPoint earlier, we want to try and combine as many resources into the one interface as possible. So we try to eliminate disconnects between, say, clinical content and drug information. I've got a list of drugs here that are considered possible treatment options for this condition for my stable patient. If I want to navigate or find the information about these drugs, they're all hyperlinked right within the content. If I want to view information about lidocaine, then I just click on it and I'm brought right to my lidocaine monograph. Again, I've got my quick links on the left-hand side. If I want to look for adverse reactions from this drug, I click on the link and then here's my adverse drug reactions. Again, written in bullet points, quick to the point, and using acronyms or shorthand wherever possible to make sure that I can absorb that information as quickly as possible. A lot of times I refer to this as saying, in life, you may want to sometimes be looking at a textbook. Other times you may want the cheat sheet. When you're taking the test, you want to make sure that you can find the answers quickly. Although the textbook is wonderful for helping you do the research and get the background knowledge that you need, when it's time to make a choice on that multiple choice test, the cheat sheet is probably what you want. And that's what we focus on when we're trying to, again, focus on point of care. Another example of how we try to focus on that, again, I'm going to go to my dosing section here at the top of my monograph. If I want dosing information for this drug, it's right here at the top. I've got an adult dosing section. I've got a pediatric dosing section. PEPID includes over 1,200 pediatric dosing calculators, which is a huge differentiator. Again, there's other resources for dosing calculators. There's other resources for clinical content, other resources for drug information. But we try to combine them all so that you don't have to open other tabs, like I was saying. If I want to do a quick dosing calculation for a pediatric patient, I click on the blue hyperlink, just like I was able to click on the link to look at drug information before. And then on my left-hand side, I've got my dosing calculator now. I can enter my patient's weight and then hit calculate. And then I've got my dosing has been completed. I've got the amount that I need to give based on my specific patient. And all of our medical calculators, all of our tools, they're regularly researched, regularly updated to make sure that they correspond with the latest guidelines. So you can just do the calculation and you don't have to do extra research on your own to make sure that you're complying with the latest standards or what have you. This is a good time to also highlight, like I was saying, these dosing calculators are based on evidence-based guidelines. So is all of our content. If I scroll to the bottom of any monograph, you can see that we've got our references are always going to be cited at the bottom. You can always see the source of the information, and it comes from the evidence-based resources you would expect, textbooks, journals, those kinds of things. We have an in-house staff of medically licensed clinical professionals, physicians, nurses, pharmacists, who review those evidence-based resources and then combine and curate the relevant information into the tool that you see here. So in a nutshell, that is some of the points that we consider to be most crucial when creating a resource that's truly point-of-care ready. Want to thank everybody for taking the time to join us today. And we're just going to say, if you're at all interested in what you've seen here today, if you think that PEPID might be a resource that you or your staff could use, I would encourage you all to go to our website. It's just pepid.com. Once you go there, you'll see that there's a link right in the top right-hand corner here to start a free trial. You can click on that and get signed up. There's no credit card or anything required. You get to use the resource for 2 weeks for free. There's no obligation. So I encourage everyone to do that. If you're looking for alternatives, if you've ever decided that you might want, I need to click on my link, pepid.com/trial is the URL. And you can try out any of the suites that we have for all of our different specialties and see if it works for you. I know that anecdotally from speaking to our subscribers myself, that they find that this resource can save them time, save them headaches when they are at point of care, and that's our goal. That's our whole pride and joy here at PEPID. Thanks everyone for joining. I hope that you have a great rest of your day. Thanks for attending.